This is the Paltalk News Network.
The views expressed are solely those of the speaker and not necessarily those of Paltalk.com, AVM Software, or its advertisers.
News Talk is online. News Talk Online, a production of Paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users on demand on iTunes and on YouTube and on my blog, GaryBaumgarten.com, where you're encouraged to post your comments, whether you agree with yours truly or not. No retribution. And thanks to our good friends at CRN Digital Talk Radio, we're syndicated to an additional 12 million households. I am your host, Gary Baumgarten. I welcome you to the show. The good-looking gentleman to my right, your left, I will be introducing, and distinguished-looking. I will be introducing to you in just a moment. Before I do, those aren't the notes I need. Before I do, I want to remind you of a couple of things. I want you guys to go to the Paltalk News Network site, paltalknewsnetwork.com, often and check in, because there's a lot of stuff on there that you're not going to see in the mainstream media, including an essay that I wrote entitled, "Don't Worry, Mr. Ahmadinejad, you don't have to worry about new sanctions this year," in which I suggest that if the President of the United States put in as much time in holding Iran's feet to the fire as he is trying to get this health care bill that we are going to be talking about in just a second pass so quickly, maybe we would be in a better shape as a world community than we are today. But that's just me. You remember, you don't have to agree with me. You just have to read me. Remember, guys, on January the 7th, we will be interviewing on the Make It Pro TV, MAKEITPRO TV show in the radio and television section on Paltalk, the incomparable Michelle Granger, who is probably the best pitcher ever to walk the earth, male or female. She's an Olympic pitcher, or was. She's going to be right here on Make It Pro TV. If you go to her wall at makeitpro.com/profile/Michelle-Granger and register for free, there's a good chance you might get an upgraded nickname, premium nickname on Paltalk that you can use for yourself or give away as a gift, or a nice limited edition t-shirt from Make It Pro. So you want to do that. Okay, we've heard a lot about health care reform from the politicians. It's about time we talk to a doctor who knows a little bit about it. To my right, your left, Dr. Michael Pryce, P-R-Y-C-E, who's written this gorgeous book, ANATHEMA, America's War on Medicine, ANATHEMA. You're in private practice, in a small practice in Ohio.
Yes, I am.
So the rules and regulations under the current health program really put a guy like you in the squeeze, because you're spending probably 50% or more of your office's time filling out forms, and
paperwork is overwhelming. It's now between 90 and 120 hours a week just to get done what I could do in a 60-hour week.
So we do need reform.
Big time.
Everybody agrees.
Absolutely.
But the reform the president is, well, I don't even know whether it's the president's plan anymore, and I don't even know what we're going to get. And frankly, if you weren't, well, an orthopedic surgeon such as yourself is an MD, right? So you can prescribe pain medication?
Right.
Okay, because I get a headache every time I talk about this subject. Because, first of all, we're not getting what the president campaigned. We're not getting a universal health care plan.
No.
I don't know what we're getting, because the Senate plan and the House plan are markedly different. So we won't know until they both pass a plan and it goes into committee. And from my perspective, they've been doing so much compromising with this plan to satisfy all the various constituencies so that they get enough votes that they put together a camel. And you know what that looks like.
Right. It's been done behind closed doors, late night votes.
Yeah.
And there's nothing that we can really read about unless you want to print out the 2,200 pages and try to weed yourself through this legalese that they wrote it in. It's not health care. It's a political solution to a doctor-patient problem. And it simply is not going to change anything other than the fact that people like me are going to, they're going to squeeze me on both ends. They're going to tax me at the high end, and they're going to take away my reimbursements at the low end. But my salary isn't what's at stake here. It's health care for the American people. We are still going to have people that aren't going to get health care. Provisions in this bill say that they can restrict or eliminate anybody with special needs, but they're not defined. So what's special needs? Is it someone that has diabetes really bad?
Some of my audience would say I qualify.
I mean, we have a relative on our family that has cystic fibrosis.
Mm-hmm.
He'll be eliminated because they don't want to pay for a lung transplant when it comes due.
Right.
So the death panels are here, whether we want them or not. And
but they are now as well, right?
Absolutely, they are.
I mean, let's be fair about it. I mean, and I've oft repeated this for my audience that when my father was deathly ill and the doctor prescribed medication that he needed to maintain his life, and he wrote it out with 3 refills. And my sister, the day after my father was released from the hospital, my sister goes to the pharmacy and hands the pharmacist the prescription with 3 refills, and the pharmacist dutifully fills it because it was approved. So I go back to Detroit to visit my dad during his recuperation. It's a month later. I go with the bottle, and they say to me, "I'm sorry, Mr. Baumgarten, we can't refill this." I said, "What do you mean you can't refill this?" They said, "Well, your dad's insurance won't allow for the refill." Yeah. Well, they allowed for the original.
Yes.
It's ridiculous.
Oh, we get denials all the time. In fact, in my book, I've renamed managed care managed denial.
Yes.
Because that's just what it is. We see so many denials now. It's unbelievable. I don't know how anyone on a standard income can even think about getting along in the healthcare system to come, because there's going to be like 50 new taxes in this bill, and we've already got people who can't afford to live now.
Right.
What's going to happen when they get all these new taxes?
Well, and of course, that's the other thing that you point out. We're in a recession, and we're going to tax the American public to death with this, and we're going to throw the country into a depression, probably.
Well, I think that's where we're headed.
Yeah.
And we'll be in a depression without quality health care.
Yeah, much worse. And you point out as well that we barely are prepared today, and barely prepared with these various plans to meet health needs on a normal situation. But let's say there was some kind of, God forbid, biological attack upon the populace of the United States by somebody who doesn't like the way we wear blue jeans or something.
That's right.
God forbid that. How would we handle it?
Well, the doctors would be there to handle it. I mean, the doctors would do the health care. It's how it's going to get paid for, and it more than likely will not.
There's a story today, Dr. Pryce, that says that there are doctors who are leaving private practice. My right hand to God on this, ladies and gentlemen. They're leaving private practice in order to become physicians in prison systems.